In Masigiria in Kajiado County, several farmers have started relocating their livestock in Isinya in a bid to save them from the biting drought that has gripped the region. The October, November, December short rain season is largely expected to be below average, and this has had massive impact on the residents of Kutui and Kajiado. Hundreds struggle to access clean water, healthcare and food, with ripple effects stretching from livestock deaths to malnutrition and menstrual health challenges among young girls. Our reporter Susan Waberu traveled to Kajiado and Kutui counties and filed the following report.
On our way into villages in Kajiado, we encounter livestock on the move, cattle trekking toward nearby Isinya town, which is over 60 kilometers away in search of pasture after the region received short rains. Further ahead, the impact of prolonged dryness is unmistakable. Emaciated cows and goats graze on bare earth. At a once functioning water catchment, goats desperately scrap the mud searching for a drop of water. Children, some barely 10 years old, struggle beside donkeys strapped with jerrycans. They have walked for kilometers just to fetch water that may not even be safe to drink. We arrive at Masigiria village, where residents tell us they are living through one of the toughest seasons yet. For many households, even basic hygiene like taking a bath depends on whether the day's water can stretch far enough.
Hata kuwapikia watoto wadogo ni taabu. Utaweza kosa maji ya kumpikia. Ile maji kidogo unapata, afadhali umpigie mara moja kwa siku ndio upate maji mengine at least ya kumuoshea nguo, ya kumsafisha ndio at least msurvive.
These residents rely on this single well, but the water inside is murky, full of green algae and infested with insects. According to villagers, when cows drink the water, bugs such as leeches lodge inside their mouths, causing bleeding. The area chairman says even children drink the same unboiled water because there's simply no alternative. He adds that new mothers and their infants rely on it too.
Tuko na cases ya hii maji sababu kuna watoto wawili kama wametumia hii maji wakapata hiyo tududu imeingia hapa. Na hiyo tududu inaingia ikiwa kidogo, lakini ikifika hapa kwa mtu inakuwa kubwa. So unaweza kuta umekimbiza kabla hujafikisha mahali unafikisha hospitali around 60 kilometers ashafariki.
The residents were previously relying on this river Ilasu, which dried up. Now they are patiently waiting and hoping for rains, which are very unpredictable. Food scarcity compounds the crisis. Mothers who have recently given birth say they survive on one meal, thin porridge prepared in the evening. The little they make must be shared among their children, and on the days they have nothing, they sleep on an empty stomach.
Njaa ni kubwa sana kwa mama hii nini. Anateseka sana wakizaa. Abura mwingine anakaa miezi 2 hivi, anachukua mtoto kwa tumbo aende kutafuta chakula. Mtoto analia tu, hata analia hadi apewe maji.
The consequences are visible. Some children are severely malnourished. Nurses and CHPs warn that the crisis is imminent, especially after the USAID supply of supplements was cut.
Mothers wanna deliver underweight babies. So far hatujapokea any supplements za watoto. Na hiyo inachangia sana. Unajua mtoto akiwa underweight ako prone to many infections, diseases.
Tuna advise wazazi wapea watoto lishe bora. Lakini tunapata watu challenge kwamba kuna wale hawezi kufikia pale lishe bora wanole watoto matunda na ile unga ya uji. Kwa hiyo tumekuwa na challenge sana na tunajaribu kumanage hiyo nutrition, lakini kwa sasa tuko chini sana.
Hospitals are kilometers away, with rough roads making access nearly impossible. Even when mothers manage to arrive, facilities lack equipment and staff. Like this dispensary in Olemirmir, which is relied on by over 30,000 people, has got only 3 beds where only one is a maternal bed. Many women choose to deliver at home. After birth, they often remain unwashed because there is no water, exposing them and their infants to infections.
Maji yenye hospitali inatumika hadi inyeshe. Na kama ijanyesha hakuna maji kwa hapo.
For thousands of women here, childbirth is not a medical moment. It's a fight for survival against long distances, poor roads, and unequipped hospitals that cannot save them. They are now urging the government to come to their rescue. In Kutui County, dried up rivers and collapsing water sources are forcing girls to modify even the most private and sensitive routines. 2 girls tell us that during their menstrual periods, they must carry an extra jerrycan of water for personal use.
Afisa anabebanga mitungi 3. Sasa nenda kuchota maji ya nyumbani. Nikifika nyumbani, nachukua mitungi ingine 2. Moja nabeba na mgongo na 10 liters na mikono. Nenda kuchota yangu ya kutumia.
Na anaweka tu anaweza ficha. Mkisa angeiona angetumia.
For years, organizations such as the Kenya Red Cross Society have stepped in with food assistance, medical outreaches and the rehabilitation of water points in an effort to restore hope. But without sufficient funding, these efforts are increasingly strained. Back in Kajiado and Kutui, families continue their daily struggle for survival, walking long distances for dirty water, battling hunger, delivering children in unsafe conditions and trying to sustain their livestock. For communities in these counties, the crisis is not looming, it is already here. Susan Owero, NTV.